So currently, we have a situation where they want people to stay at home, which is good, because in this equation, what has happened is they're drawing out time. The longer you can go before being exposed or contracting the virus, the better for you. A couple of reasons. One, the virus might mutate into a lesser virulent form and be better for you. Western medicine might come up with a good vaccine or better ways to treat it, so time is on your side. So there's many reasons to avoid and delay potential of getting this virus. The thing is, most people are probably going to get the virus and never even know it. They'll get maybe 10 virons, 100 virons, 1,000 virons, never have any symptoms, develop immunity, a nice clean immunity, and be protected. Even though they might test positive, they'd be protected essentially. So delaying the exposure, you might get it eventually, but you might not even know it. The people at most risk apparently has been shown to be older people. I think it's not because they just are old, but because they're more likely to have other problems and a deficient immune system. So the current recommendation is on people with diabetes, vascular issues, COPD, or perhaps asthma, are more likely to have pulmonary problems underlying that would be, they have less reserve for getting any upper respiratory illness. A thing I tell people, I've told people, if you're getting on an elevator or touching buttons in an airport, touch them with your knuckle, not your finger, because we subconsciously touch our face a lot. You could say, I'm not going to touch my face, but you'll do it anyway. And we all are like that. So the fronts of the fingers are what we usually touch our face with. So by using your knuckle or a wrist or a forearm to open things, you're just decreasing that, along with the obvious, which has been said, wash your hands a lot. There have been talks about how you can wash your hands like a surgeon does, a little more thorough, fingernails, etc. All that's useful. So when traveling, of course, obviously don't go if you don't have to. As far as the mask, I don't wear one at home, and if I go driving around, I'm not wearing one. But if I were to go to an area where I know I'm going to be exposed, yeah, I'd bring it and probably wear it, especially in this current situation. So you have to decide. With this video, no one out there listening is my patient at this time. Don't want you to be my patient, sorry, but I'm doing other things. So don't consider this legal medical advice to you. You must decide what you want to do, go by what your doctor says. I partially have to give you this legal notice because it's such a legal world, unfortunately. A lot of things being done in society about this virus even are basically politically based probably, and maybe legally based. People don't want to get sued. Nonetheless, we are where we are. The recommendations are generally good. I think the response has been pretty good at this point. I mean, I think we were seemingly overdoing it, but it's an unknown. If you're under the age of 50, you're most likely to get some virins in you, immunity, and never even know it. People at risk, again, are the higher age people with underlying problems, and those people should be much more careful in what they do. So decreasing the amount of viruses you take into your body, I would suggest also, in Ayurvedic terms, respiratory-wise, you want to avoid cold and dry and airy foods. You want to drink warm room temperature liquids or even warm to hot. You could do heavy saltwater mouth rinses, gargles, but it has to be very concentrated. Breathing through your nose. The nose is meant to aerate. It has turbinates in them to humidify the air, but I think we will come to find out that the nose and the turbinates are more involved in the immune system than we know about currently. So it seems to be breathing through the nose is more protective than breathing through your mouth. So don't be talking to people. Keep your mouth closed, and you'll less likely breathe them through things that will get into your throat and get into your body. Often overlooked, but sometimes the most subtle and simple things are crucial. That's why this new term, social distancing, is really very, very accurate for what is the solution for now to delay and diminish the quantity of viruses that are out there. The reason I said this virus with time is on your side, because new diseases tend to be more virulent, more deadly. For example, in the old days, tuberculosis was very deadly. With time, it evolved into a less virulent form. The reason for that is because something that kills its hosts is not good for the disease either. They like to have hosts that can keep on living, and they keep living. So that's why time is to a degree on your side with this current virus, along with the potential for Western medicine to give you a vaccine. When it comes to vaccines, vaccines are kind of dirty medicine, I'll call it that. So I'd rather, if I was healthy, risk getting the virus, get immunity to it naturally. But if I had an illness where I was like, hey, I'm kind of compromised already, I would have to very heavily consider getting the immunization. And there's more will come out about that as we go. Now, the immune system. There are things one can do to boost your immune system, and if not antiviral things you can do. So, immune system-wise, what I have recommended to people is, and what I have done personally years ago when I traveled, if I felt something coming on, right, a little itch in the throat, a scratch, a little uncomfortable, I would take vitamin D3, 20,000 units a day times 3 days. That's it, stop. A little higher dose than normal, but for 3 days, it can quick start the immune system. There have been studies that show that it improves the immune system to take vitamin D3. Again, 3 days only is what I do. Some people think it releases your stores of white blood cells. Evidence is still working on that, but it's relatively safe. A lot of what my recommendations are risk versus benefit. If it's relatively low risk and potentially great benefit, more likely to do it. Again, consult your doctor before doing anything that I'm saying. That's the legal thing to tell you, because if billions of people did this, someone would have a problem with something at some point. It's just the odds. So vitamin D3, it's going to be important for immune system, and it works relatively quickly. The second thing I personally do is I take zinc citrate, or a zinc picolinate. The better form must be in a capsule. I take 15 to 20 milligrams twice a day for about 4 days. I mean, this is it. That's all I do. Starting the D3 and the zinc at the same time also can boost your immune system. If you have issues with your stomach, sensitive stomach, you might need to take it after food, or perhaps not at all, but it can be a little irritating to the stomach, but citrate and picolinate are better forms. Don't go rush out to any big box store and buy the cheapest stuff you can buy. I wrote a book about poor use of supplements. You want to buy a capsule or a soft gel, anything that's in a tablet form, unless it's meant to be sublingual or sustained release, is usually an inferior product in my opinion. You have to look at the label to be sure, but a vegetarian capsule or a soft gel is going to be a higher quality product, meaning you can absorb more of it. It's really bad to go out and take something you think you're getting, you're not really absorbing it. So you think you're protecting yourself, but you're not. So vitamin D3, 20,000 units a day times 3 days. It's a higher dose than normal, but it's only 3 days. The zinc picolinate or citrate twice a day, 15 to 20 milligrams for 4 days. Third thing I do is I take vitamin C. I take 1,000 milligrams 5 times a day. You got to spread it out, and I do that for about 5 days. It's very simple, very limited. Now, could you do it longer? Sure, but that's what I recommend is 5 days. Could be hard on your stomach if you have a sensitive stomach. Most people don't have a problem. Liposomal vitamin C, more absorbed, costs a little bit more. I could go on about subtle factors, nth degree things, but I'm trying to make this more to the point with a little explanation. So vitamin C for about 5 days. If you actually came down with something, you could consider taking these longer, but you definitely need doctor advice and guidance for that. The last thing I do are certain herbs that are have had studies that have shown they can be antiviral, anti-infectious. Again, these studies have varied over time. They find studies, some say, yeah, yes, they work, others say, no, they don't. I think the studies have shown they don't. Probably we're underdosing the herb. I personally take olive leaf with me when I go on a trip. Feel something coming out, that's the other thing I take for about 5 days. I'll take a heavier dose of olive leaf 2 or 3 times a day for 5 days, and I'm done. If you're really highly concerned, you could consider taking, in addition or instead of elderberry. Again, you have to make sure you get a high enough dose on it, and that's up for evaluation too, but the higher dose is recommended for sure. And again, if you're really concerned, you could add golden seal echinacea. There have been negative studies on them that they don't really help, but other historical use has been that they do. So I think since the harm is relatively little risk, potentially higher benefit, if you're dealing with a really bad virus, I would consider it. I would definitely consider it. Hey, if it was me and I came down with it, I would get on them. You have to decide yourself, though, because the studies I'm telling you are a bit mixed on it, but they have historical use of and reports of them being effective antiviral. So that's what I can tell you about my position in what I told my patients years ago, how to lower the risk and improve the treatment of upper respiratory infections. If I think of anything else, I'll add on this clip. Hopefully I've covered everything, and have a great day.